Hi, everyone. Cassie Adams here with the ALS Association. I'm really excited that this is our second episode of our Facebook Live educational series. And the purpose of these videos is really just to bring information and resources to all of you and have a chance for us all to connect, particularly during this pretty unique time in history. So throughout the presentation today, we really want to make this a conversation. So we invite all of you to ask questions in the Facebook chat box. And we're going to do our very best to make sure that we answer all of your questions today. And if we don't get to anything during the presentation, we will be sure to get back to you as soon as possible in the chat. We would also invite you to reach out to myself or to Amanda at any point personally, just to see how we can help support you. So without further ado, I'm really excited to introduce my amazing colleague, Amanda Mason. Amanda started as the Assistive Technology Services Coordinator with our chapter in 2017, and she has been wonderful in helping people to communicate and stay connected with technology and in connecting with their loved ones. And she, although is not a Pacific Northwest native, she is an avid hiker, and she loves spending time with her dogs and her husband, who I've heard she makes practice a lot of her technology with. So I'd love to turn it over to Amanda to share a little bit about what she's going to be talking about today and what kind of questions she can help answer for you.
Great. Thank you, Cassie. So like Cassie said, I'm Amanda Mason. I'm the Assistive Technology Coordinator here at the chapter. I'm also a speech language pathologist by education. And my role here at the chapter, for those of you who might not know, is kind of filling in the gaps. So I do, well, in normal times, I do everything from, home visits. Now that's usually more video visits. I go to the different ALS clinics around Portland and support those clinics and their speech therapists. I have a loan closet that's specifically communication devices and assisted technology pieces of equipment. And basically, I kind of just work hand in hand with the community-based speech language pathologists to make sure that your needs are all kind of met. So with that being said, we've been talking a lot at the chapter about communication and how important it is and how different it is right now, because obviously things have changed a lot in the past couple of months. And so we thought that today is a good opportunity to kind of talk about that and what your options, and like Cassie said, how we can help with staying connected. First, I kind of want to make sure you know your resources, because I feel like sometimes it's like, who do I even ask what I don't know? Happens a lot. So I'm, of course, here to help. You can always call, email me if you are more connected with Cassie, or you might know Susan or some of our other care service coordinators. They can always connect us or reach out to me to help with questions or loan closet requests and things like that. And also, now is a great time to also reach out to your either like your clinic speech therapist or maybe your home health speech therapist that you may have connected with before. I feel like sometimes people think that these kinds of communication questions aren't top of mind right now, but they really should be a priority. Like staying connected with healthcare professionals, but also family and friends is really important. So, to start off, like, what are some of the ways that we can do this, right? Like, how do we stay connected when we kind of have to be home all the time and they have to be home all the time? What do we do? So the good news is there's almost too many options. It can be almost overwhelming. And things, that can affect your choices are, what kind of phone you have or what computer you have, all that stuff. But those are kind of the dirty details, but just know that there is a way to stay connected. It's just finding the right one for you. And a lot of them are honestly probably already set up for you, already at your fingertips. You don't have to make a new account or download anything. They're probably already right there. So for example, video chatting. is, all the rage right now, of course. And I imagine that a lot of you guys have had experience with this to an extent, maybe with healthcare providers. I know a lot of people are able to do telehealth right now, or maybe some of your ALS Association staff members. I know we're doing a lot of telehealth visits and video chats right now, but it's a great way to stay connected with your friends and family too. Many of them are free, and if you have something like a Facebook account or an iPhone or a Gmail account or things like that, those all have automatically built-in video chat options. So you don't have to make a new account, you don't have to download something. It's just finding the right button to press to turn your phone call from your phone into a video call. And then you're connected in kind of a different way maybe than you could have been before. I think it's also really worth noting that you can video chat with many speech generating devices that you might have. And just as an aside, a speech generating device is a piece of equipment that can basically help you communicate. It can generate speech for you when you can't anymore. And a lot of these tend to have alternative access methods. So if typing or using a typical mouse isn't easy anymore, there's different access methods like eye gaze, or maybe a really big mouse you could use with your foot, or all different kinds of things like that that can be used with these devices. And those are most often compatible with a lot of these different video chat systems, which is nice. You can also, if you're like, oh, but talking is a little hard, or it's hard for me to be understood over video calls, it's also, a good tip that you can use a text-to-speech app to talk over video chats. So you can kind of get the best of both worlds. You can have your face-to-face video chat, but then you could use an app like something like this. This is just one example I have on a tablet of mine. Let's see. Sorry if you can't see it very well, but basically I get to type out a message and then I hit speak, and let's see if you can hear it.
My name is Amanda.
And it speaks for me. I have a microphone on, so it's probably not quite as clear, but we could work on setting up different mics and everything. But that way I could communicate still just like I was in face-to-face with a person over video chat. There also are a lot of different, what they call chat options on different video call systems, where you can have next to your screens, next to your picture on your computer, you can have a box where you can type out messages in whatever method is easy for you, instead of using your voice. You can kind of communicate that way too. Those are just a couple of examples. That's kind of a good place to start maybe.
Yeah, great. Thank you, Amanda.
Yeah.
Something that I think has been coming up a lot is we've been offering some virtual support groups and how people can get involved in that way. And you talked a little bit about the speech to text apps as being a good option for people. For those who may be less technologically inclined, would you be able to offer those kinds of some of that sort of support to people to kind of walk them through how to get going in some of these platforms?
Definitely. And I think we've been working as a team, I know, to make those virtual support groups as seamless and hopefully as easy as possible for everyone to get connected with, as far as hopefully you just open your email, click a link, and you're in. And then if you want an app to kind of help support you in that space, I can help figure out, what kind of phone you have, what kind of tablet you might have, whatever your device is, what's compatible with that, and what will meet your needs. So absolutely.
Great.
Yeah.
It looks like we've got a couple of people. Robyn and Brian have joined us, so really excited. And both Robyn and Brian are avid users of lots of pieces of technology to kind of communicate. I know as we've been talking about how important it is to stay connected, do you have any suggestions for people who are using their speech generating devices, they're at home and they're really wanting to connect in with family more, but maybe struggling with how to help support their family members in connecting via technology and using some of these platforms? Any tips or advice?
Oh, that's a great question. If you're thinking along the lines of kind of how to teach someone who's not comfortable, maybe using FaceTime, how to use FaceTime over FaceTime. It does get complicated. I can help with that. There also are actually quite a few I've found to be very helpful videos online. So if you YouTube like how to FaceTime, that can be a really good like kind of visual aid. I'm a very visual learner. It also can be helpful to send screenshots sometimes if you're trying to show someone like just press the video button, but they can't find it and everyone's getting frustrated. Like for example, I have a screenshot just of a phone call to my mom on here, and I could my FaceTime button is here. So if I was trying to send her, trying to tell her how to FaceTime me, I could send her this shot and circle this with a highlighter and tell her, you hit this button here and that's how you FaceTime, something like that. A lot of visual aids are helpful, I find, rather than trying to go back and forth over like email or the phone or something like that.
Nice. That's a really good tip. I've seen a lot of people doing some really fun, creative things over video that we might not have thought about doing before. For example, some families doing game nights or playing a game, alongside their family member. And although people probably already know about this resource, I've just recently learned about Netflix Party and some of these other systems that are out there that can kind of help you to connect and just enjoy moments with people, because, we're all kind of in the same boat of being in our homes. And I've heard a lot of ALS, people with ALS mention that, they're often more accustomed to staying inside. And so this isn't terribly new, but to not be able to see grandkids, to see adult kids, I know there's just a big longing to be able to connect with people and at least to see them face to face. So it's really neat that these options are available for people.
That's such a good point. And I just to elaborate that a little bit, it's a lot of those games are built into a lot of the systems that we have. So like the Facebook Messenger video chat option has a bunch of games built into it already. You don't have to like add on an app or anything like that, which is nice because it's just one less step of technology to figure out. And you can be playing, a quick trivia game, or there's, certain apps for video chats and games too, like there's one called House Party that a lot of people have been using for trivia or like Pictionary games or things like that too. It's super
nice.
Yeah.
So Brian has a comment that he made. Brian says, I have found that chat windows in video calls can be a pain and really frustrating to use. My next plan is to try to use a phone or another tablet for the video call, and then I can use my iPad for communicating.
Yes, I like that a lot. And I totally agree with you, Brian. I've seen that become frustrating, and I've seen it work really well the other way too, where like you're saying, you use your tablet or your computer for maybe the video part, and then you can be texting or messaging on your phone or something together to kind of communicate more. And I think that's a great idea, to just keep it a little more simple. Sometimes that's the easy answer.
Well, and I wonder too, Amanda, if that is similarly applicable to a situation where someone who uses a speech generating device to communicate, but also uses that as their tool to access some of these methods. I'm thinking of someone who uses a speech generating device and wants to participate in one of our support groups, for example. Would you recommend that they also have a backup method, or what would you
think? I think yes, I definitely would. I kind of have been encouraging people, and I've been experimenting with this as it has become clearly more of a concern and issue for us, is how to connect people who are using speech generating devices over, like video chats and things like that. And it's worth trying if you have another device available, even if it's a phone or something, maybe smaller, not as good quality, to have your speech generating device, whatever it is, be your voice, and have the other device be the device that you video chat on. I think that kind of takes off a layer of switching between windows, and it can kind of get complicated, and systems don't always work seamlessly with each other, and it can get really frustrating, I think. So that's a really good point.
Well, and I would really strongly recommend, if anybody's listening today, if that just sounds completely overwhelming to you, we get it. And
Yes.
it's pretty overwhelming, I think, to most of us. And that's why we're here to help. And that's why Amanda is so wonderful and patient and able to kind of help guide us through this process as we're all trying to figure this out. We think bottom line is just don't want people to go without communicating and connecting.
Exactly.
For those reasons. So
exactly.
Another kind of comment and question that's been coming up, I think, a lot as we're all living in this new kind of COVID-19 environment is around just kind of preparing and prepping for any kind of an emergency situation that might happen. So I'm thinking of, the prospect that I might have to go into a hospital and possibly not have the same kind of advocacy and support that I'm used to from my support group or my spouse or my caregiver, or those kinds of situations in which you're kind of planning to have less contact or less ability to connect in the ways that we're used to.
Yeah.
I'm thinking there's some really good resources out there for just kind of emergency planning, but I'm also wondering in kind of for a communication perspective, if there's anything that you might recommend that people kind of think about ahead of time before, like something to put in their go bag, if you will, just to make communication easier if there was an instance in which somebody had to go into the hospital.
Yeah, I think that's such a good question and so important right now because, yeah, like you said, situations are different perhaps than usual. Things, I know Cassie can speak a little more to, having all the paperwork done, the, whatever forms to tell what your wishes are ultimately, but having communication systems in place that can be easily and quickly and hopefully relatively seamlessly put into place with busy hospital staff is essential. And maybe that's something like, maybe you use a speech generating device, but you have, something like a simple, relatively free app on your phone or tablet that's easy. It can be easily accessible and can be just your backup for the moment. Or maybe it's having a printed letter board that, yes, like I know not everyone's super excited about the prospect of spelling out their messages letter by letter, but having that as a backup and instructions printed, which I can help with both of those, getting both of those to you, having that in your go bag so that, a nurse or a caregiver can pull it out quickly and say, oh, okay, this is how we can communicate with this person right now until we can get whatever other communication system in place is invaluable, because that way you can get your wants and needs met. You can make sure you're in charge of your healthcare and communication that way. That's a great question.
Great. Another concern that has come up, I know for some folks, is around call systems in hospitals and also in care facility settings. And I'm just wondering if you might be able to talk about a little bit about different kinds of call systems and why that might be kind of an important thing just to think about now.
Yeah, absolutely. I think call systems, when you're at home, it can be, you can take the time and figure out what works for you. But in a hospital, they usually have pretty specific systems you have to work with to be able to page your nurse rather than just to make a chime that they might hear, maybe once and be like, okay, I'll get that in a second, and then it slips their mind. So there's a few buttons or switches that I really like that are easily accessible for most people. It's that one in particular you can hit easily with like your head as a soft touch, or your foot or your elbow, or of course, your hands, whatever works and is easy for you. And it plugs into a lot of different care facility, whether it's a hospital or skilled nursing or something, into their systems. So then it acts as a regular call system button when you're in a facility. And if that's not the right answer, if that button doesn't work or whatever else I have in my closet, I've actually been learning a lot about call systems recently because, like you said, this has been coming up, and working with the different alarm companies for internal call systems, and learning that they have many more options than a lot of us know or think about. Like usually you think of a call system in a hospital and you think of maybe the little red button, or maybe you get like a pull string option, but they have so many choices, and so far they've been really helpful with figuring out what's right for the person that I'm calling about. So that's always worth, either calling, asking your facility, asking me to kind of do some background research and figure out what your options are. There's choices out there for a call system, because that's really important.
Great, great. And I just wanted to circle back to just mention that Amanda brought up that it's a good idea just in general to have a go bag.
Oh yeah.
Hopefully, certainly nobody is having to use that go bag. That's the goal, is not to ever have to use it. But when we refer to a go bag, it's just a good couple of items to have just in the back of the truck, or in the back of, or the hook on the back of the door, or whatever. A good thing to also include is a document that's called an advance directive. And this is just a document that you can go through with your family, and really just allows you to indicate what your wishes are in the event that you're not able to communicate those wishes. And it appoints also a healthcare representative. And that would be, really very clearly indicated, this is the person who can help make those decisions. Another really important thing would be to include medical records and just kind of history and information just in general about ALS. And our national office put out a really good document that I think is helpful for this. And it's just a key medical information packet. And they also have an app so that you can have it downloaded on your phone with just your basic information. Also, some really important guidelines for hospital systems around ALS, like that oxygen is not generally indicated for people with ALS, and just to help kind of bring more of the advocacy and awareness front of mind, particularly when hospital systems are short-staffed and they're scrambling and things are just in a really different space right now. And we can post that link to the chat box at the end of the meeting today if anybody's interested in checking that out. And if you'd want to talk more about kind of this idea of an emergency go bag and anything you might need, feel free to reach out to us and we're happy to talk you through it.
Yeah, definitely.
One other thought that I had, Amanda, for you, and feel free, anybody, if you've got some more questions, feel free to send them on in, is around just that, we're stuck inside right now. We're not as apt to be able to necessarily connect with speech therapists. Maybe that would be from the clinic or having a home health speech therapist come in. Are there any things just as a speech therapist that you might recommend that people are spend some time doing right now or thinking about in terms of just planning for the future, or just maybe having some more time where they could spend to research some things?
Yeah, that's a great question. I'll probably get on my little soapbox for a minute that many of you probably heard about, voice banking, because that is a great project for right now when we're all kind of I don't know, maybe there's a little bit more nervous energy or kind of weird feelings. You have more time just to do something that you've been putting off. And it's a good time for voice banking. So voice banking, just so we're on the same page, is the process of giving a company your basically samples of your voice, so that later, if there's a time when you can't use your own voice, they can make you a synthetic voice that sounds a lot like you. There are other synthetic voices online that you can buy. A lot come with different apps and things that you can download, communication softwares and such. But some people really want to have their voice, even when maybe they can't use it physically. And voice banking, there's a couple. I've got a whole long handout I can send anyone who's interested, but essentially it's sitting down at your computer, usually with a good headset mic like I have today, and recording a bunch of sentences. It can take a little while. It's kind of time consuming, so I know why it gets put off, but now's a great time to do it if you think you might want to do it at all. And I can help you get started. I can walk through the registration and initial setup and loan you a microphone if you need, if you don't happen to have one, or direct you where you can buy one, and get you started on that, because it's a worthwhile project.
Great, great. I know it takes a lot of time to do, so I've heard you talk about it many times, and I think it's a good proactive kind of step that people can take, especially if there is some nervous energy, and I think we all kind of need a good outlet right now.
Exactly.
that brings me to my kind of my last question or thought for you, Amanda, and that's, I think with a lot of nervous energy right now and just a lot of uncertainty, many people are really just struggling, not just with staying connected to people, but also just with how to spend our time in, if I'm not able to go outside and not able to, do some of my normal routines, what are some ways that I can use technology in kind of a new way to spend my time. And I know that there are a lot of different things that people can do in terms of like games or just fun ways of connecting. But I also know that like video game users, there's a lot of really adaptive tools now for people who play video games, or a kind of adaptive ways of environmental controls. So I'm just wondering if you might just touch on a little bit of that for people to think about right now.
That's such a great point. Because yes, there are so many, it feels like the video game industry finally got the word, like I guess it's kind of middle of last year, that people who can't use a typical controller still want to play video games. And so they've been coming up with a ton of different ways to make their games more accessible. And they're not perfect yet, but like Xbox, for example, I imagine a lot of people heard about their accessible controller that they released, that the controller itself is more accessible, but it also has 19 different ports on the back that essentially if you plugged a switch or a button into every one of those ports, you could do any combination of moves that you could make with a regular controller just by the press of a button. And I'll admit, I'm not a huge gamer myself, although I'm becoming more and more interested because of all these tech advances that they've been making. It's getting more exciting. But there's things like this that are pretty accessible. They're easy. You can buy that controller off the shelf. And I can help set up buttons and things like that. So that's an easy one to put into place. But there's also, I've been working on a project with someone to try to figure out how to fly things like drones, which is really delicate joystick control with your thumbs. And that can get difficult for some people with ALS, and how to keep him flying drones. And we've been making some progress. It's still work. That's still a project I'm working on, but I mean, pretty much anything's possible. We just have to find the right person who can build the right thing for us. So it's exciting.
Very cool.
Yeah.
Very cool. Well, good takeaways that people, before just resting things and deciding not to pursue the things that you love doing, let's see if we can help brainstorm some options and come up with some new solutions, because living right now is what we have, and
yes,
see how we can enjoy it.
That's exactly right. There's almost always an option. If there's not, I do enjoy a challenge. So let me know.
Right.
Yeah.
Right. Well, we're coming up on our time, Amanda. Any last parting thoughts that you might want to share?
I think just to reiterate what you said, Cassie, that there's always a way. I think like I really never want to talk to someone who says I stopped doing X, whatever that was, because it was too hard. I really want to keep you and everyone connected, whether it's, playing their video games, or, flying drones, or just chatting with their grandkids, whatever it is. There's pretty much always a way to figure it out, so you can do what you want to do.
Great. Well, thanks so much, Amanda. I really appreciated us being able to talk to everybody today, and thanks for everybody who listened.
Thanks, guys.
We are going to be posting this later, so if you wanted to share it out with somebody, or anybody missed the presentation today, you can watch it as many times as you want. And we are also going to have another guest on next week. So if you're interested, tune in. It's going to be Wednesday, April 29th at 3 o'clock. And we're going to be joined by Kate Morris, who is a psychologist who practices at Salem Hospital and also has a private practice. Some of you who may have attended the mindfulness class that's offered at Providence may have met her. She co-facilitates that. And she's really going to be coming on to talk with us just about kind of coping with just not only the unknowns that come with ALS, but also with COVID-19 and the pandemic, and just how we can all kind of support ourselves and one another in good self-care practices. So hope to see you all then. And again, really appreciate you guys tuning in, and hope you have a good rest of your day. Thanks, everyone.
Bye.